you a surgeon? Why are you a surgeon?
That's a question I get asked weekly.
Yeah.
And I've been in practice for a bunch of weeks, for 20 years. So I always get asked, when am I going to go back and finish my residency? When am I going to grow up and become a surgeon like Dr. Gerling, even though he's about 15 years younger than me, and so forth. And so there's a sports medicine specialty that exists within primary care. So many of us are family medicine trained to begin with, but we did an extra year of training, what they call fellowship after our residency, to be specialized in non-operative sports medicine, musculoskeletal medicine, primary care sports medicine, whatever you want to call it. And we can become board certified in it. And fortunately here at Sports Medicine Associates, there's more than half a dozen of us that this is our career. We're really busy enough doing this. We don't do any primary care. The fact of the matter is that while a lot of stuff is surgical, probably the majority of what walks in the office is non-surgical.
Absolutely.
We're trained to recognize, hey, you're not going to get better without surgery. I need to get you in quickly, versus here are your options. And quite honestly, in the end, I think a lot of patients, once they realize that, really appreciate the fact that not only the primary care sports medicine docs, the surgeons as well, I'm not looking at surgery as the first and only outcome. Right. What are my options? Let me decide. Tell me what the pros and cons and what can I expect, and then we go from there. And I think for some people it's confusing at first, but in the end, it generates a lot of referrals because they understand how we do stuff.
When they say in the world of a hammer, everybody's a nail, it's like if you only go to a surgical practice and that's all there is, you're probably going to end up with a lot of surgeries. So I think it's really useful in our practice to know we have both elements there all the time. You've got the sports medicine side that focuses on the non-operative treatment with a huge amount of interventional options. And then you have the surgical side available, and we cross over a ton. But I think it's valuable to have folks in the office that aren't necessarily surgical. And it's not because you couldn't have done it. It's purely because that's the decision you made, and that's where the clinical pathway was. So I think it's still valuable.
Yeah, it's still
funny
good.
That you get asked that.
I think I'm grown up, though. I'm not going to make any career changes. I think my wife would appreciate it.
Probably.